Okay. Good evening. It is 5 p.m. I'm Rob Watton. I'm calling the Public Safety Committee and Committee of the Whole to order. And first off is roll call. We have present council members Christensen and Cotton. Welcome. And City Administrator Mike Chambliss, as well as City Clerk Dean is online. And please note that we also have Captain Harase. Am I close? Harose. Okay. And Chief Bailey. Okay, I'll go to speech school next. Okay, thank you very much. With that, move to adopt the agenda that's before us. Council members, thank you. In stereo. Council members, are there any changes or additions to tonight's agenda? Hearing none, we will approve the agenda as presented. At this time, we open the meeting for public comments on items that are not already on the agenda. Anyone in the council chambers are invited to come forward to share their concerns. They have 3 minutes. I'm not seeing anyone raising their hand to do so, but those joining us online, you can always send your comments straight to the council members or to the city clerk, and we'll make sure that those are addressed accordingly. And with that, I close the public comment period. Next, we move on to minutes. Approval of the minutes dated October 7th, 2024. Council members, are there any corrections, additions to the minutes as presented? No. Hearing none, we will accept the minutes as presented. And with that, we move on to agenda bills. This is AB 24-091. 2025 Northeast King County Regional Public Safety Communications Agency, otherwise known as NORCOM, and Chief Bailey, would you care to fill us in?
Good evening. So Agenda Bill 099 has to do with NORCOM's budget allocation for next year. This is something we do every year. As a reminder, NORCOM is our dispatch agency who covers all of the Zone 1 fire department and some police departments for King County. They're based out of Bellevue. So every year per the ILA documents, the governing board has to pass a budget. And then the members of the board, which I am a member of, all the agencies are, reviews the budget, approves it, and then it goes out to each individual agency to have them reaffirm that they want to basically be in the NORCOM for next year and that they're going to pay their portion of the budget. The budget's based on per call, per call versus, and also valuation. Valuation of the city's assets. Not the city's assets. The valuation of the, I gotta look it up here because I'm just losing my mind. I don't know what the city's evaluation for business in the city. So the total valuation, assessed valuation, that's the word I was looking for. I apologize. Assessed valuation is what's based off of our percentage of the budget that we pay.
So assessed valuation of all structures.
Assess valuation of the city, which is the numbers gotten through finance of all structures in the city. Yes, not just the city's assets. I said it wrong, but assess valuation of the city as well as how often we use NORCOM. So they use the call totals for just the city calls, not any mutual aid responses. It's just city responses. So for this year, the budget for next year, the budget is going to be $70,594, which is a 5.2% increase from last year. Last year was a 0% increase because they added some new agencies, some new police agencies to NORCOM, so they're able to have a 0% increase because of that. This year, it's a 5.2% increase. And that adds a few more positions in Norcom and then just keeps them up to date. It covers their general operating expenses. There wasn't any specific dollar amount or specific program that they're adding to. It was just more the overall budget, other than the 2 FTEs that they added. So this is just the agenda bill that could go to council, just approving that we're gonna, and this is something that's been budgeted for by finance. It's included in next year's budget already. And it's the exact dollar amount because we got the numbers before the budget was presented.
Excellent. Council members, I'll start off with Councilmember Christensen and then Councilmember Cotton.
All right. So I have a few questions. And this first one goes back to the accreditation report that we'd gotten. Obviously, our fire department was voted to get accreditation again this year, which is fantastic. But there was a question on that referring to the established call handling time, and it said that the agency identified that Norcom was not meeting the 60-second benchmark for alarm handling time as defined by the NFPA 1225. And my question was whether that has been addressed and how much of a differential we have in terms of the time and the deadline in the NFPA.
Yeah, sure. So Norcom has a different reporting standard than the fire department does. So they have a different accreditation that they use. And a couple of things that are in their annual report from 2023, because they obviously haven't done 24 yet, is the National Emergency Numbers Association. First of all, it has to do with the amount of time it takes to answer a call. The guideline for that is 15 seconds. And Norcom hits that 96% of the time. They answer the call under 15 seconds. So they're way ahead of the mark on that one in regards to in regards to the amount of calls that are dispatched for fire, as in, so from when the call is answered to when we're actually dispatching fire units, Norcom's goal is to get it in 60 seconds, 90% of the time, and then to get it in 120 seconds, 99% of the time. So those are the two benchmarks that they use. Currently, so last year in 23, Norcom was at 80%. And the year before that, they're at 83%. So I reached out to them to find, and then for the 120, they are actually at 94%. So they're closer when obviously when you get to 120 seconds, but for the 60 seconds, they're at about 80% of the time they get it answered in 60 seconds. And I reached out to Norcom to ask them if they had some explanations and just to get some more background information on that. And so they said, just like everybody else, staffing levels, they've had a high turnover in dispatchers. So they are, their number, that's what they've equated to that 3% going down is that number is they've just had a lot of new dispatchers. And so newer dispatchers are a little bit slower than the fully trained ones. That was one of them. And the other reason that they gave was cell phones. The NFPA standard was created back quite a few years ago at 60 seconds. And back then, most of the calls they received were landline phones. And landline phone, it pops up on the screen, who you're calling, where you're calling, address, all that information is displayed on their screen automatically. Cell phones, which account for over 80% of their calls, doesn't have that information. So the dispatchers have to take a little bit longer. They have to ask for where are you calling from, give them the address. And so, obviously our fire liaison, Corey James, is that, that's not an excuse. That's just an explanation as to why they don't necessarily meet that NFPA standard all of the time. But it is something that they talk about. They do, their medical dispatches are a lot higher than their fire dispatches, just because for medical dispatches, they can do a quick dispatch, which basically, as soon as they find out what the problem is, they can send somebody right away. Fire takes a little bit longer. They have to question exactly what's going on. So he did say that's a number that they look at constantly. It's in their annual report, but he said they also look at it just like we do with our accreditation. They look at it monthly. They have training, it's something they focus on. So they have recognized that deficiency and they're working on it. But those were just some of the explanations as to why they weren't quite at that NFPA 60-second one.
Okay. Thank you, Chief.
Excellent. Councilmember Cotton then.
Just a quick question is, since the interlocal agreement is I don't know if it's the original but it's dated 2007. Is there an updated version coming out or?
There's been amendments to that. And I believe the one that it was The original one was 2007, but the last one I believe was 2018. And I thought I included that one, but let me double check to make sure that that one was included on the before it goes to the other count. I'll make sure, but I thought I double checked that the most recent one is the one I sent out.
Okay.
Okay. Councilmember Christensen.
Thanks. So back when I was the chair, I attended one of the NORCOM principals meeting, and I know that they talked about the safeguards in place in the event that, you know, for example, the communications go down in the building. But could you speak a little bit to that, just since I know that they are handling the calls for a lot of the cities nearby, and just making sure that there are backups in place?
Sure. A couple things on that. So first of all, how they handle multiple calls, or not even multiple, when they have a large volume of calls, they have a couple of SOPs and procedures in place to how they handle that. The first one is that they can siphon off, or they can filter calls. And the best example would be the 4th of July. Any calls that are related to the 4th of July immediately go to a dedicated 1 or 2 dispatchers that handle only those calls, call takers and dispatchers. So that way they can make sure that they don't get overwhelmed with the 20, 30, or even, you know, a couple hundred calls they get for fireworks. So that's the first layer they have in place. The second layer is that they cross-train all of their dispatchers for multiple positions. So they're trained, you know, they differentiate between police and fire, call taker, receiver, and dispatcher. Everybody is cross-trained for every position. So it's easier to shift personnel from one location in the dispatch center to these other locations to you know, to bridge up when they need some extra assistance. And then also it makes it easier for them to call in more personnel, because they don't have to look for a specific, I need to get overtime for a call taker, I need to get a call taker here right away. They can just get the closest dispatcher to come in to handle that. And then the last layer they have is they always have the ability to, in emergency situations, send calls to a different call center, a different PSAP, which could be Issaquah Police, it could be Redmond Police. They have different areas that they could send, you know, calls out to different, to handle the backup load. But he said, Corey said, there's never been a case where they've been overwhelmed. It's more that they, you know, they have these procedures in place that they can follow to get that extra help. But they do have a backup center in Redmond. Redmond is their backup center, and it's I term it as a turnkey, as in all it takes is for them to go in, fire up the computers, and then it can automatically start taking over the calls from NORCOM, which is housed in Bellevue. So if there's ever a time that they have to evacuate Bellevue, they have set procedures in place, which is basically they would put, you know, they can transfer the calls to another PSAP temporarily. They put dispatchers in a police vehicle and they go code to Redmond, which is about a 10-minute ride, and then they can get that up and running. You know, like I said, it's a turnkey location. So that's another thing they have in place to this backup location, which is located at the Redmond Police Department.
Wonderful. Thank you, Chief.
Any other questions? Those are fabulous questions. Thank you for doing your homework. All right, Chief, anything else to add?
Yeah.
My one question approaching on the alternate dispatch center is with our emergency operations center at the fire station. There were times where, like during floods and stuff like that, where we didn't have communications, you know, outside. And so we were actually doing some dispatching. It was minimal, but there was like sending people out in dump trucks to go pick up people in the mobile home park, or, you know, those kinds of things. So is that something that potentially we can still do there in an extreme situation, or? Yeah.
So a couple of layers to that. So first of all, NORCOM has they call a resource emergency. So when we start having multiple calls for, like, for example, there's a windstorm event and we start getting all those calls for power lines down, they stop dispatching those and they force them to the dispatch printer of a specific station, which is separate from the other line. So it's more reliable, and they have different in place for contacting, like the battalion chief. So when it gets overwhelmed with those kind of calls and they call a resource emergency, they basically hand off those lower level calls to the fire department to handle as they see fit, and they don't dispatch those out over the air. They're not given a run number. So that's one layer. And then the second layer, which you were talking about with the EOC, is, you know, if they do declare a resource emergency, or we're completely out of communication because, say, an earthquake, We do have the ability to, our CCAS group can staff that radio room, and we can use a couple different ways. VHF to communicate. All the city vehicles still have a VHF radio in them. They're not normally used by Public Works anymore, but they have them inside their vehicles. The police vehicles have them. We have them. We have portables that have VHF. So that's our backup system for radio communication. So in the event that NORCOM doesn't dispatch us out, we would be able to use our resource center, the EOC, the communication center, and then combination talking with radio back and forth to King County Emergency Management, NORCOM. We have these different radio channels they'd be able to use to be able to get notifications of those emergencies, so then we can start prioritizing them and sending units out.
Thanks, Chief.
Excellent. So the next question before us is, shall we pass this on to the full council? And do we do it as a consent agenda, or do we want a presentation?
I would recommend consent.
I would too, yeah.
Consent?
It's,
Okay,
you know, just
there we go.
re-upping.
Okay. Clerk Dean, please make note of that. We are going to add this AB 24-099 and recommend that be added to the consent agenda.
One other thing I wanted to add too is at any time, if you're ever interested in visiting NORCOM, we can take you down there of a tour, and they can go through and show you, if you're curious to see how they dispatch, how they handle different emergencies, I can set up a tour with them. If you're ever interested, I can set up with Corey. He's more than happy to show off their facility. They have a great facility down there in Bellevue, and they're more than happy to walk you through and go over it with you. So just let me know if you'd like to set that up. I know right now they're doing a lot of construction and some stuff down there they're adding new consoles, but in the next, in another month or two, or, sometime later next year, just let me know and we can set that up and we can do a tour down at NORCOM to see how they operate down there.
Excellent. Would that be like a just one-on-one sort of thing, or would you suggest that we do it as offer it up to any of the council members?
I would say just for, I would say probably for the Public Safety Committee, we'd want to start there, and then maybe if they want to do down the road, because then we start worrying about having a meeting with, some of the rules about a public meeting. Maybe. Right. So I would say either one-on-one or start with the Public Safety Committee, and then we can always do it. But, that's something we could set up if we wanted to down the road.
Okay. Awesome. Thank you very much, Chief. Moving on. Discussion, Sexual Assault Center project presentation. Captain Jerez.
Good evening, everybody. So the police department has been in communication with the Snoqualmie Valley Hospital, and particularly Catherine Thompson, who is one of the program managers there. We are extremely excited of this opportunity. It's an education-based program where community members can learn about, violence prevention, things they can do if, and who their resources are in the area, to include the hospital. It is something that we, like I said, are extremely excited to work with. We're working with Catherine on even building her program into the Citizens Academy, and things like that. So without further ado, I will let Catherine take over and present her program to you.
Thank you. Welcome, Catherine.
Good evening, Council. I'm Catherine Thompson. I work as a PA at Snoqualmie Valley Health, and I'm now the program manager for Snoqualmie Valley Assault Treatment Services, SVATS. And what we are starting with is forensic examination for older adolescents and adults. We've received some grant funding for that. And so we'll be building out that program towards at the end of this year, and anticipated to go live in the beginning of 2025. We hope to expand from there. I am trained as a forensic examiner, have a lot of experience in that area. And I also have a lot of scholarship. I'm a PhD candidate in forensic psychology. So I'm doing a lot of work in this area And I view violence treatment and prevention in a very comprehensive way. So as the captain said, like it's really very much about like prevention and education, wraparound resources for people who may experience violence, are experiencing violence, or may in the future. And some of the ways that we are addressing that is we will be having excellent access to our primary care resources as well. So if anybody gets a forensic exam through us or interacts with law enforcement, they have the opportunity to follow up in our primary care clinics next day or the day after. We have embedded mental health as well. We have next day advocacy with King County Sexual Assault Resource Center. And we're like really excited about like what a lot of the other kind of programs that we can build. So I will stop there and see if anybody has any questions. Or I can tell you also about like kind of what our future plans are as well.
Any questions, council?
I'll save for the end.
Okay.
Okay.
Yes, please.
So
Okay.
I interrupt you.
So my ambition has never particularly been my problem. So I have big dreams for this program. I'd actually like to see us become a complete forensic medicine program and child advocacy center. If we accomplished that, we would be the closest child advocacy center, and that would be doing forensic exams and interviews for children who experience abuse. We would be the closest between Spokane and Harborview or Marybridge. So we would span a large geographic region. And actually, same with forensic exams for adults and adolescents as well. The next closest centers to us are Kirkland. Evergreen Health has a program. Overlake is on shaky legs, but they're trying to stand theirs back up again, but they do not have 24/7 access right now. And then next closest would be either Harborview or Everett. So we would occupy a very important region. I have plans to apply for more grant funding, bigger like kind of federal and regional grants that can help us kind of stand some of this up. But that would be kind of the goal. And then that also encompasses kind of the Family Justice Center model, if you've heard of that, which would be a very collaborative program between law enforcement, health services, forensic services, mental health, advocacy, kind of all resources, prosecution, all resources under one roof. Or next to one roof that can provide really comprehensive and important care for survivors.
Excellent. So a month and a half ago, I attended a domestic violence breakfast hosted by the prosecuting attorney's office. Amazing work. I mean, it's one of those things that we don't really hear a lot about, but they shared some of the statistics on kind of going back to root causes. You know, if you look at felonies, offenses, and how they're connected so oftentimes with domestic violence. You look at gun violence, and it's connected oftentimes with domestic violence and all that. So, you know, it's one of those things that it's easy to kind of just shellac, if you will, to gloss over. You know, if it's not me, if it's not affecting me, but you know, it's coming back to this whole idea is that if we can address the root causes, it will help de-escalate. It will help lower the number of crimes. It'll help, you know, a number of different ways. So the more I think that, you know, that's can be shared, and I'll tell you, it was overwhelming to get all this information packed into about 15 minutes trying to absorb it all because it is so profound. So I appreciate all the work that you're doing. Obviously, you're going to earn your PhD in doing all this work.
Yes, I hope so one day. I'm like eyeballs deep in data right now, but you know, so the end seems very far away, but I assume one day I will actually finish. Yes.
Excellent. Any other questions?
Yeah.
Councilmember Cotton.
Do you anticipate that, as you were saying at the beginning of the year, you hope to get things up and running, and I know the police department is very excited about at least having something, you know, nearby as far as for, you know, victims of an assault and such. Do you anticipate, because I know we've emailed about some things, do you anticipate that it will at that time be starting off like certain hours, or that you will be 24/7? Or I know that you would like to get like 2 social workers onto um, that kind of platform. And I know that takes some doing to get all those things in place.
Yes, so that's an excellent question. The program is me, myself, and I right now. So what we are planning on doing is for sure offering scheduled hours. And also I will be on call for questions or navigation or doing more urgent or emergent exams as needed. And so I've been talking to some of the other program managers in the state who run small programs or like nascent programs. And most of them do this a similar way where they will kind of triage incoming cases as they arrive and give the survivors the opportunity to decide whether they'd like to come in now, whenever now is, or whether they would like to come get some sleep, come in at 8 a.m., 9 a.m. the next morning. And so that's our plan too, is to do it very similar to that. And I will have some help with the triage as well, because we'll be routing calls through the emergency room to start. So the front desk people, I have a meeting with them in a couple of weeks to talk about the flow of the phone call and the phone tree and the decision making there.
Especially with certain cases where you need to collect evidence. Yes. I mean, that's something that can't wait till the next morning, or those types of things. So do you anticipate it might be a few months before it's just you, or I'm sure you would want to have a life too, but
this is my life.
Yeah.
Yeah, so there is a lot more flexibility these days with forensic evidence collection. We have up to 120 hours and sometimes even longer to collect really viable forensic evidence. They've even collected like adequate DNA samples from like mouths or other, like cracks or crevices like umbilicus up to like a week or two after the initial incident. And so certainly some of that is, an area of sensitivity, because we want survivors to feel comfortable and supported and safe, which is why we're approaching it as a sort of a triage picture and an options picture, as opposed to, sorry, we're not available right now, you'll have to come in later.
So do you envision your program being larger than the hospital district itself? Is this going to be more of a regional approach that other agencies will want to access?
Yes, I'm anticipating for sure that there will be some additional interest outside the cities of like Snoqualmie and North Bend.
And then following that is, we're working on our legislative agenda. Is there a way that the council through this committee be supportive of what you need, the resources? Because obviously it's bigger than just our community. And it might be something that the legislature that we can address through our public safety piece.
I would love that. I don't actually know what the request is, because I don't know what to ask for. But I'm certainly would love to be a part of that legislative agenda.
And that's something that our police department can help out with. Is that correct? In helping us frame that a little bit better.
So yes, we can help kind of frame that and give guidance, direction on what would be needed. Obviously, make staffing for them, whether that would be grant type money from the state to help fund making sure she has adequate staffing, things like that. But yeah, we're willing to help. And no different than us putting, we've talked about putting classes on at the department for the community to come to and have sessions and things like that where they can be away from their area concerns and things like that.
Great, excellent. Any further questions? Yes, Councilmember Christensen.
Thank you. I was just going to ask, and I understand that a number of sexual assaults obviously are going to go unreported, but do you have a general figure for what you're seeing in North and Snoqualmie versus the greater area?
Yeah, that's an excellent question. And unfortunately, we don't have excellent data on that because we've been diverting cases for so long. And we, when they get diverted, they get coded into the program that they go to. So basically, like they just inflate like Everett's or Harborview's numbers. But we don't necessarily know because we, particularly in Snoqualmie, have not been tracking anybody who comes through the health system that is diverted for forensic care. I do know that Chief Lynch and I talked about some of the numbers for like the major crime task force. And it sounds like, I think there was like maybe like 18 to 20 in the last year or something like that. Is that right?
They vary. We recently had one that we sent up to Harborview for an exam. So I can have some numbers run to give you a better idea of what we're looking at within the two cities. As far as the task force goes, it varies, and each agency may handle their own. So I may not get a call out particularly for, let's say, Enumclaw, who has a few detectives versus Duval, who doesn't have any, and they use their patrol guys. So everybody's a little different, but I can definitely run some numbers on how many calls we've had or reports we've taken, and get back to you.
Okay. Thank you.
Excellent.
This is reported. Do you have a sense of the percentage of maybe compared to that number of the reported, the percentage of unreported?
Yes. So nationally, the average reporting cadence is about 30% of suspected crime. So, and that's based off of like the National Crime Victimization Survey, which is an anonymous survey that asks about victimization of various different types of crime, including sexual assault and domestic violence. So they get different numbers with that survey than law enforcement does, because this is like, were you victimized in the last year, basically. Yeah. So about 30% is about the average reporting rate for sexual violence. And then it's about the same, maybe a little lower for domestic violence. And then there's a whole different sort of very complex psychology and dynamic to intimate partner violence.
Thank you. Okay.
Very important. Very important.
Yeah.
We'll see more of you. I know we will.
Yeah.
Thank you, Ms. Thompson.
Thanks.
All right. Much to consider. I want to move on to our next topic. We only have 15 minutes or so, maybe 12 minutes on our public safety agenda, legislative agenda. I just want to lead off with this. You know, in the past, we've identified legislation that's come up before the legislature in very specific terms, which is good. Thank you very much. But it's also a little bit reactive. And what I'd like to entertain tonight are what are the things that we can help suggest, encourage in the formation of legislation reforms that are needed, that are particular interest to City of Snoqualmie. You know, we just heard one, and that is, you know, we can kind of roll into one, you know, whether it be support of ongoing mental health professional, because that's kind of been a temporary fix, and also addressing domestic violence, sexual violence, and all that, so that we could focus more on preventative ways or ways to help decrease, you know, the risk to individuals, risk to community. And then the other one too is going back to SR 18. I know it's on the transportation side, but it's also a public safety issue as well. And going back 10 years ago, we were told by the legislators then, Representative Jay Rodney, that it's not going to get the attention of the state unless it's the loss of life. And we had that happen, and it suddenly elevated SR 18 on the state transportation list. And I think that we need to continue to emphasize that, because right now the funding is very iffy for the completion of SR 18, and that needs to be done. So anyway, those are my input, but I'm going to turn it over to the other two council members, because I'm sure you have things on your wish list as well. And Clerk Dean, will you help me in tracking these as well? Presume you're there online. So I'm going to start off with Council Member Christensen. Do you have things that you'd like to add, modify?
Yeah, so, and I kind of alluded to it at the last council meeting. But at least for police pursuit, on our 2024 council priorities, we'd included further expanding crimes for pursuit to include auto theft and some property crimes. It's my understanding that, so first of all, going back to June of this year, right, the legislature did end up going forward and expanding it. It didn't cover, I think, absolutely everything that would have been nice, but they did go ahead and expand it a bit, which is helpful. It's my further understanding that there may not be a whole lot of intent there to expand it further, so it might be a good time to pull that off and maybe focus on some of our other priorities. In addition, if we did want to go ahead and try to find other ways that might be helpful, it sounds like there is some additional new tech and other things that can help. For example, track cars that have been flagged as doing something wrong, that would also enable the police to take a step back and not have to follow as closely. So I would probably recommend pulling that one at this time, and instead focusing on some of the other things, because I think that officer recruitment and retention is probably, at least for me, of the public safety, the most important. Just, you know, Washington is at this point has the least number of police officers per capita. And I know that it's a constant struggle trying to get qualified folks in, not just at our police department, obviously, but across the state as well. Seattle's actually gone forward to offering $50,000 signing bonuses for lateral officers. And I'm kind of wondering if I should be that even. But, you know, obviously it would be great if there were, right? If there were some state options that would help, especially for the smaller municipalities that may need help getting some more folks in there. I know that they've also done some work in terms of offering additional locations for police academy and things like that, which can help draw new folks in. And we're not having to wait as long once we hire folks to get them into the academy. But if there are any additional funding tools that could help the smaller municipalities to go ahead and fund additional folks to join, that would be great.
Okay, excellent. I would concur on the police pursuits, unless there's some other need that we're unaware of, and we're really talking about high priorities and things that we need to address, and going back and addressing something that's been at least partially, or we know that it has broader support in the legislature. Sometimes we have to choose our battles and you know, see how it goes. I mean, it's only been a matter of months since that's been in place, a couple months really. So you know, giving that time to settle out, we'll have a better idea in the following legislative sessions.
Yep.
Right. Excellent. Councilmember Cotton, I'm sure you have a few things that you'd like to add.
Well, certainly along the lines of what Councilmember Christensen was mentioning. And I know, of course, the police, some of the concerns that we have for them too will also depend on the contract resolution, I guess, as far as how that goes as well. But yes, I certainly agree that police and even fire retention, while we're getting more folks in and we're funding more positions, it's being able to retain the folks that we do get in. Absolutely. And, you know, be competitive with the other agencies that are involved around us. And I know we'll be starting our the public safety sales tax, which will give us some additional funding as well. And so there definitely are things that we can continue to look at and be aware of, you know, that being a priority. I know I hear it said many times by the citizens in the community about how important public safety is to them and how much they love their police and fire department. So definitely that's high on my list. I have a couple other areas that certainly are lower to that. And one is, well, maybe not completely lower to that, but involved with that is, one is working on the starting to disperse or finding ways to get out the opioid settlement funding. And well, I realized the mayor's out of town. I did reach out to her before she left. And so when she gets back, we definitely want to, kind of get together and start talking about, how does the city, want to get the input from the community? How do we want to address the, how we disperse it? Do we form a council of knowledgeable folks that, are separate that do that? And anyway, to get that ball rolling so that we can, well, it's not a lot of money, but it's still, doing the things like, public education and seeing where we can put that to the best needs and wants of the community. I know it's been on the King County level and the state level daunting for cities. Not a lot of cities have started dispersing the funds because of all the hoops they have to jump through and figure out. So I think certainly I think we should be working on that as well. And I think that comes under our purview for public safety, definitely with the opioid epidemic.
So since it was a one-time settlement and it's for our city, it amounts to a little over $16,000 a year. It works out to be $1.25 per resident. But I think, right, I think the bigger issue perhaps is, taking a look at the underlying drug problems that exist and how we can continue to support communities like ours in having the resources. Wow. So that would be worthwhile. Anything else? We only have a couple more minutes left, and we're just kind of sketching things out to come back to and flesh out between now and the end of the year, really.
One other thing that I just traffic safety, and I know that I think that's probably the thing that we get the most citizens coming in to have concerns about. And so I definitely think that while I know from comments that the city administrator made previously that a lot is being done like around schools, which is great. That is a priority for sure. But I definitely think we need to do or consider traffic calming measures for the downtown, like 202, since we're getting more and more pedestrian traffic there, where, whether it's, and I know it's WashDOT for 202, but whether it's signage or, the solar panel, your speed is, as they're cruising in and out of town or whatever, but just things to think about and see how we can address that.
Okay. And those are more handled on the city level. And I guess, for the legislative piece is what are the things that we can change statewide that will have an impact on us here.
If we needed to go that route, since this was a
state route, I would defer to the city administrator if there are roadblocks that cities need more leeway or more discretion over.
Well, what we always could use some help with is our Safe Routes to School grant applications. We got passed over last time, and that's the type of stuff that we use that money to purchase. not a big fan of the driver feedback signs because they go to help, use those to set high scores.
Yeah.
But definitely want to implement some new technology in crosswalk, especially in the downtown, where it actually illuminates the crosswalk while people are crossing the street from the sides. So there's no lights in the street. It's an elevated lamp that comes on and illuminates the whole crosswalk and everybody in it. I think downtown, I think there are some school sites that could benefit from that greatly. And we are going to be submitting another application for funding so we can do that.
Super.
Do you get a sense that sometimes those dollars are given to certain cities, larger cities, and smaller cities are overlooked for them? Or is it just
I never say that out loud. I can assure you that there are entire departments in cities that go after those funds.
Okay. Okay. So we can talk more offline about that. Anything else for the good of the order tonight? Thank you. We'll make note of these and kind of work on these between now and when we consider it at the council level as well. But I think being able to prioritize that would be the next thing. Is there are certain things that probably bubble to the top that are like more immediate and other things that are long-term, which we should have there as well. All right. And if you have any of those concerns, just, you know, if you want to make sure that they get on this, I guess send it to me so that we can kind of put these together and then bring them back. Are we okay, Councilmember Christensen, because you're involved with PIC as well? If we come back in 2 weeks and kind of refine this, I mean, are we really under the gun to get this out sooner than later, or?
They would like it, but they also understand the realities that these will be going to them as we get to the new year.
Okay.
So.
All right. I don't want to miss the boat on this. All right.
Thank
With
you.
that, is there anything else for us this evening? Hearing nothing, I will entertain the motion to adjourn.
So moved.
Second.
It's been moved by Councilmember Christensen, seconded by Councilmember Cotton. And with that, we are adjourned at 5:47 p.m. Thank you very much.
I have a question.